Elimite Cream is a medication used to treat scabies, which is caused by tiny insects called mites that infest and irritate the skin. The active ingredient, permethrin, belongs to a class of drugs known as pyrethrins. It works by paralyzing and killing the mites and their eggs. To use this cream, apply it to the affected areas of the skin and leave it on for a specific amount of time before washing it off. The dosage and duration of use will depend on your medical condition and response to treatment. It is important to follow the instructions provided by your doctor or pharmacist. It is best to apply this cream in the evening and leave it on overnight for the best results. If you have any questions or concerns about using Elimite Cream, consult with your healthcare provider for further guidance. If you've been prescribed Elimite Cream, it's important to know that it's meant for use on the skin only. Apply the cream from your head to the soles of your feet, including under your nails and in skin folds as directed. Massage the cream into the skin, and be sure not to use more than prescribed. After 8 to 14 hours, wash off the cream by showering or taking a bath. It's important to avoid getting the cream into your eyes, nose, mouth, or vagina. If it does get into your eyes, flush them with plenty of water and consult your doctor if irritation lasts. If you're experiencing intense itching, especially at bedtime, and you see small, fine, wavy lines on the skin with a tiny insect at the end, you may have scabies. Even if the permethrin in the cream kills all the scabies, the dead mites can still make you itch for up to 4 weeks after treatment. If your condition lasts or gets worse 2 weeks after treatment, be sure to tell your doctor. They may need to look for living mites and recommend more treatment. If you have scabies, you may experience skin irritation such as itching, swelling, and redness, which may worsen temporarily after using Elimite Cream. You may also feel a mild burning or stinging sensation. If these effects persist or become worse, it's important to inform your doctor or pharmacist. It's essential to remember that this medication has been prescribed to you because the benefits outweigh the potential side effects. Most people who use this medication do not experience serious side effects. While it's rare, a severe allergic reaction to Elimite Cream can occur. If you notice symptoms such as rash, itching or swelling of the face, tongue, or throat, severe dizziness, or difficulty breathing, seek medical help immediately. This is not an exhaustive list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects. If you are in the US, you can call your doctor for medical advice about the side effects, or report them to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report them to Health Canada at 1-866-234-2345. Before using Elimite Cream, make sure to inform your healthcare provider if you have any allergies to permethrin or any other allergies. This cream may contain inactive ingredients that could potentially cause allergic reactions, so it's important to discuss this with your pharmacist. Additionally, it's important to inform your doctor or pharmacist about your medical history, especially if you have had skin infections or asthma. If you find yourself constantly scratching your skin or scalp, it could lead to a bacterial skin infection. If you notice worsening redness or pus, be sure to contact your doctor right away. If you are pregnant, it's important to inform your doctor before using this medication. While it is uncertain if this drug passes into breast milk, it is unlikely to harm a nursing infant. However, it's best to consult your doctor before breastfeeding. When using Elimite Cream, it is important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. To help manage this, keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It is crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. This will ensure the safe and effective use of Elimite Cream. If someone accidentally swallows Elimite Cream, it can be harmful. If the person has serious symptoms such as passing out or trouble breathing, call 911. Otherwise, contact a poison control center immediately. In the US, you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Symptoms of an overdose may include dizziness, severe headache, severe vomiting, weakness, and seizures. Remember, it's important not to share this medication with others. When using Elimite Cream, you typically only need one application. To prevent spreading scabies to others or getting reinfected, make sure to wash any clothing and bed linens that have been in contact with your skin in the 2 days prior to treatment. This can be done by machine washing with hot water and drying in a hot dryer for 20 minutes, dry cleaning, or keeping them away from body contact for 72 hours. Also, it's a good idea for people who are in close contact with the infected person, such as household members, to also be checked for scabies. Elimite Cream is a prescription medication used to treat scabies, a skin condition caused by tiny insects called mites. It works by killing the mites and their eggs. This cream is for external use only and should not be used near the eyes. To use Elimite Cream, apply a thin layer to clean, dry skin and leave it on for 8 to 14 hours before washing it off. It is usually applied once, but your doctor may recommend a second treatment if necessary. Be sure to follow your doctor's instructions and talk to them about any concerns you may have. Make sure to store Elimite Cream at room temperature, away from children and pets. It's important to not flush the medication down the toilet or pour it into a drain unless instructed to do so. When the cream is expired or no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.